Hello everyone, I am Sakshi, counseling psychologist at TalktoAngel. Welcome to our channel series on clinical disorders. Episode 1, Addiction. Today we have Dr. R.K. Suri, clinical psychologist with us to talk about addiction.
Thank you, Sakshi. Today we will discuss about addiction. What is addiction? Addiction is dependence on drug or alcohol, which means dependence on any substance which is impacting psychologically, socially, economically, as well as the overall well-being to an individual and family. Now, this is predominantly what we refer as an addiction.
Okay. But sir, how it affects our mind?
Now, when we talk about how addiction impacts mind, addiction predominantly influences your functionality if it is dependent on any of these substances which are psychotropic in nature. It may be alcohol, it may be a substance, caffeine or cocaine, heroin, cannabis, etc. So these are the stimulants which impact the brain and which impacts the behavior of an individual.
Can you please tell about some common addictions?
There are two types of addiction, what we call as addiction of a substance, and the other we call as behavioral addiction. When we talk about behavioral, it means habits like your betting or online gaming or sex addiction or porn addiction. These are common behavioral addiction which influences an individual into the functionality of him, into his day-to-day operations, as well as it impacts their family.
But sir, there are some myths. Can you please discuss about them?
So there are a lot of myths. One of the myths is that for any addiction, it will automatically go away if you just marry someone. This is again a very illogical myth. Addiction doesn't go unless it is not treated properly. Now, treatment needs to be carried out in a more professional, seasoned manner. The engagement of psychologists, engagement of psychiatrists for overcoming dependence and imparting them various kind of motivational approaches like participation into the Alcoholics Anonymous or social networks helps in terms of overcoming addiction.
So yesterday I was reading a research paper. So in that one myth is if someone is addicted, so he or she must be there in a rehab center. Without that, it's not possible to be treated. Okay.
The old traditional approach was that for any kind of addiction, put him or her into a rehab center. Now, over the years, it has been found that the rehab centers also are essential in terms of helping the patient to overcome the withdrawal symptoms. But in long term, the person whosoever is addicted to any kind of substance or habit needs to be there into the ecosystem or milieu in which social milieu in which he was living. So a treatment modality working at an individual and the family would help us in terms of overcoming the addiction and not merely sending him or her to rehab center.
And there one more addiction is there, social media in adults.
There is a preponderance use of social media amongst the teenage. Social media, if it is used in an appropriate manner for promotion of any product or services, that's very good. But however, if one is addicted and is not following certain meaningful restrictions in terms of excessive uses, or is just following certain role models, he or she is just copying them, making in a similar manner, and not the real reals. Those are all those the excessive use of social media may not be encouraged, and wherever it is the excessive engagement by any of the teenager, there should be an effort by the family, by the teacher, training them how to use it. Officially use it means academically use that or socially use that media for their benefits.
Can you please share about the common treatment plans for substance use?
As I already mentioned, one of the common treatment is putting him or her for a withdrawal, and abstinence, what we call as the sobriety. The sobriety period varies from substance to substance, and invariably withdrawal symptoms starts pouring in from 24 hours to 48 hours to 72 hours, and so on and so forth. Now, in that critical period when the person is sober, he or she has a difficulty in terms of managing. At that time, medical attention is required, because he or she may be getting suicidal thoughts, he or she may be getting anxiety, depression, etc. At that time, medical attention is required. Then you have to get them engaged into the psychotherapy, which invariably we uses the CBT or DBT group therapy, and uses the social networks, and also engage the family in terms of good rightful communication, so that helps an individual to overcome the addiction process.
Thank you, sir, for the insightful session. It was a nice conversation with you. I gained some insight about the addiction. Thank you so much, sir.
Well, thank you, Sakshi, for your inquisitive approach in terms of understanding addiction and helping large number of people, the individual who are having challenges of overcoming addiction of any kind, be it a substance or be it habit, or psychologists and counselors at TalktoAngel are just click away. You can anytime reach out to us for better management of yourself or anyone in your family whosoever is having an issue with reference to any kind of addiction. Thank you very much.
Let's see you guys on episode 2. Thank you so much.